Hi partners, in this video I will be doing a quick walkthrough of the end of year survey. The goal is to provide some high-level guidance on how to respond to the various questions in the survey. Please note that I try to share relevant information for all programs. However, depending on what priority and tier your program is in, there may be times I cover questions that are not relevant to you. This information will be a recap of what was shared during the orientation session back in February. First, a couple of administrative details. Every partner will receive a personalized link to their end-of-year survey on Monday, November 2nd. It will be emailed to the person designated as the point of contact for the program. The survey will close on November 27th at 5 p.m. That's a Friday. The reporting period depends on if you're a new partner during this grant period, in which case you wouldn't have received funding in 2019. If this is you, your reporting period is January 1st, 2020 through October 31st, 2020. If you're a previous partner who received funding in 2019, your reporting period is November 1st, 2019 through October 31st, 2020. Finally, surveys are distributed by program and not organization. If your organization received funding for multiple programs, you must complete a survey for each program. The program name will be designated in the email as well as in the header at the top of the survey when you click on the link. A quick introduction for the end of year survey. This reporting tool helps Beacon Community Impact understand the impact that's being created through its investment in you. All questions are designed to help us calculate the change that's been achieved both at the individual program and aggregate level. This information is also used to assess funding decisions for the following grant cycle, create reports for Beacon leadership, and report back to the federal government based on specific requirements they set for nonprofit hospitals. As mentioned, each program will receive an individualized survey link. The questions you will see are based on what health priority and impact tier your program was designated. We have built logic into the survey so that you will only see questions relevant to your program. However, there still may be questions you can't respond to. This is okay. If you ever have any questions, please don't hesitate to reach out to your project specialist. A couple of things about using the survey. First, this survey doesn't allow for collaboration. If two people have the survey open at once, they won't be able to see what the other person is filling out in real time, and data entered may not be saved correctly. Second, you can close the survey and come back to it. However, before closing the tab, you need to click forward to the next page using the blue forward button at the bottom of each page. If you don't advance to the next page, the information on the current page won't be saved in the system. Third, we highly encourage you to only have one survey open at a time. If you have multiple tabs open with the survey in it, you might enter data into different surveys and then lose some information. So let's get into some program information. For contact information, please provide details for the individual Beacon Community Impact should reach out to in case there are questions regarding the information submitted on the survey. County alignment. Please select the counties in which programming was provided. Please note that this is where programming was provided, not where participants' home address is. Priority alignment is the designated CHNA priority area your program was assigned, either healthy mind, healthy body, healthy family, healthy spirit, or social determinants of health. This will be in the header of your survey. Also, please note that the survey logic is built into county alignment and priority alignment. So how you respond to these questions at the beginning will impact what questions you see on the rest of the survey. For quantitative outline of activities, we'd like to understand what the outputs were related to activities rather than the number of participants served. This could be something like 12 classes were delivered, 300 counseling appointments provided, 15 webinars, 40 presentations were given, 20 schools were visited, things like that. We want to know in real numbers what you did during the year. The next set of questions help us to understand how the COVID-19 pandemic has impacted your organization. Please respond as appropriate when the questions relate to your organization or program. Now getting into the quantitative reporting area of the survey, a couple of clarifiers we would like to point out. First, please note again, the reporting period for new partners is January 1st, 2020 through October 31st, 2020. For existing partners who were funded in 2019 as well as 2020, your reporting period is November 1st, 2019 through October 31st, 2020. Second, we would like to know the number of unduplicated individuals reached by your program. Third, the number served by county is where the service was provided. So if an education class is offered in Elkhart County, all participants should be counted as served in Elkhart, even if the participant's home address is in another county. This same definition should be used throughout the entire survey. Also, please note that the options you see in terms of counties and priority will be dictated by how you responded to the county and priority alignment at the beginning of the survey. Looking at the specific reach questions, there are 4 areas that are required for all programs regardless of priority and tier. They are general participation, gender, race, ethnicity, and age. Please use the same clarifiers for each. As a good check, all areas should equal the same number. We understand that your demographic criteria might be slightly different. Please do your best to complete as asked. However, we do understand there will be some variation, which is why we included options for unknown in every criteria section. The next section is for programs identified as those in knowledge or education impact tier. No matter what priority a program is in, knowledge program will see 5 questions. It's important to note that to be able to answer these questions, programs will need to have a monitoring and evaluation framework that includes a pre-assessment and a post-assessment, and the ability to compare a participant's pre and post scores. First is, didn't show knowledge prior to the program engagement. This question allows BCI to understand the number of at-risk individuals. To answer this question, programs will need to look at the pre-assessment and pull the number of participants who incorrectly responded. Second is the total number of respondents to this question. This is the number of individuals who completed the pre-evaluation, no matter whether they got the answer correct. The third question is, showed knowledge after the program engagement. Programs should look at the post-assessment and identify the number of participants who answered correctly. Then fourth is the total number of respondents to this question. So this is the number of individuals who completed the post-evaluation, no matter whether they got the answer correct. Ideally, this number would be similar to the number of pre-evaluations completed, but we understand that 100% completion of surveys is difficult to achieve. And finally, the fifth question is the total number who showed increased knowledge. To answer this, programs will need to compare the pre and post responses by individual and pull the number of participants who responded incorrectly in the pre-test, but then got the question right in the post-test. We understand this one is difficult on a number of levels. However, we think it's very important as it shows the number of individuals who actually demonstrated an increase in their knowledge level. The next set of questions is for programs in the action impact tier. Programs will be shown the indicator questions associated with their assigned health priority. Please only respond to the indicators that are relevant to your program. In most cases, this means there will be some questions that you don't respond to, and that's totally fine. For every indicator question, we're looking to understand 3 things. First, the at-risk population based on the best practice for that indicator. Second, the level of change demonstrated by participants of the program as a whole. And third, the number of individual participants who showed positive change. By looking at these 3 factors, we hope to gain a more holistic understanding of what each program was able to achieve. It's important to note that to be able to answer these questions, programs will need to have a monitoring and evaluation framework that enables the ability to compare participants before your program or intervention and after your program or intervention, so pre and post scores. I'm going to walk through one example to help illustrate this. The number of poor physical health days is a good example of what a typical indicator question looks like. For every indicator, there are typically 6 questions. First is the number of individuals who reported less than the best practice benchmark. The best practice benchmark to use will be included directly after the question. In the case of poor physical health days, the best practice benchmark is 4 or more physical health days. Second is looking at the pre-program or intake numbers for that indicator. In this case, the total number of poor days. This should be the sum of all days reported by all participants during the pre-program evaluation or intake. Third is the total number of respondents who completed a pre-program evaluation, or the total number of individuals contributing to the number of reported poor health days. The 4th and 5th questions transition into the post-evaluation, asking the same questions, but are seeking the results from the post-program survey or the most recent numbers collected. We'd like the total number who responded for the pre and post to be as similar as possible. However, again, we understand there could be some differences based on completion of programming, timing of programming, and a variety of other factors. Finally is the number who showed improvement. This will require programs to compare the pre and post tests for participants and count the ones who showed improvement. For the vast majority of indicators, you will see that while the benchmark changes based on the indicator's best practice, the format of the questions stay the same. Your project specialist will point out the few exceptions to you during your end-of-year survey review call in October, if applicable. I again want to emphasize that programs should only respond to the indicators that are relevant to their programming and were established during orientation. Please don't feel like you need to respond to every question. We do have an other data question. We understand that we're asking for very specific information that may not tell a full story of the impact your program creates. If there's additional data or outputs or outcomes that haven't been shared yet throughout the survey, here is where you can share those. So the next section is focused on ACEs. Please respond to these questions as relevant. And the last section is called growth. So first, let us know what improvements you've made in the past year. This could be a new building, implementing a new monitoring and evaluation framework, a new collaboration, partnership, so on. And then we'd like some feedback on the outcomes team support, as well as any additional feedback about Beacon Community Impact or anything you would like to provide. So this is the end of the survey. As you complete the survey, please don't hesitate to reach out to your project specialists with questions. We look forward to learning more about the great work you and your programs have been able to accomplish this year. Thanks.